Hi, Dr. Clifford Stermer from One Rheumatology in Palm Beach Gardens. I want to talk about scleroderma. In particular, I want to talk about the limited form of scleroderma. Limited systemic sclerosis is what it's called. It used to be called CREST Syndrome, and then there's also the name scleroderma, so that could be confusing. There's a few different types of scleroderma. We could get into more details about the particular types, but in this video, I want to focus on the limited systemic sclerosis, formerly called CREST. The reason it was called CREST is because CREST stands for the symptoms. The C in CREST stands for calcinosis. Some patients with this form of scleroderma get calcium deposits in their soft tissues or under the skin. This could be painful, or they could get these kind of little pieces of calcium in different parts of their body. The R stands for Raynaud. This is a very common symptom with all forms of scleroderma. That's where the fingers, the toes, or other parts of the body, when exposed to cold or when you're stressed, could change colors. They could turn white, red, or blue, and in severe cases, you could get fingertip ulcers or pits. The E in CREST stands for esophageal dysmotility. That's where patients get a lot of acid reflux, difficulty swallowing food, could regurgitate at night. So there's certain things we need to do to mitigate that. The S in CREST stands for sclerodactyly. That is a puffiness in the fingers, tapering of the fingers. And then finally, the T stands for Telangiectasia, and that's where you get in your little blood vessels, you could get these dilations, you could get little red spots on the face, around the lips, also on the hands or other parts of the body. So those are kind of the main symptoms in CREST syndrome or limited systemic sclerosis. Often people could live a normal life and they have some of these symptoms that we need to mitigate, and there's certain medications that we often have to give. Very importantly is to check your heart and lungs every year, because this form of scleroderma can, in the later years or 20 years after diagnosis, cause scarring in the lungs or interstitial lung disease. It could also cause scarring in the blood vessels that go from the heart to the lungs, and this is called pulmonary arterial hypertension. So just like you could get scarring in the little blood vessels in the fingers and Raynaud's phenomenon, later in the course of disease, patients could develop this pulmonary arterial hypertension. So the guidelines say, and I make sure all my patients get pulmonary function testing every year. That's where you blow into that machine and we look at your pulmonary function. And we also recommend an echocardiogram. That's where they do an ultrasound of the heart to look more specifically at the right side of the heart and measure its pressures.